Ambulances passing nearest hospitals.
Well, we're going to do our very best to make sure that we limit those types of tough decisions and wrong decisions in the future.
Firefighters prevented from providing life-saving care.
I hear our firefighters almost suffocated by a desire to make a difference when they show up.
Tonight, Denver's mayor is promising major changes in the wake of more than a year of reporting by Denver7 Investigates.
We're working to change that system.
His response follows reports revealing a questionable culture inside Denver Health's paramedics division, leading to dangerous delays.
Chief investigative reporter Tony Kowaleski continues his investigation tonight.
The culture needs to change.
I have a desire. We gotta fix this.
Mayor Michael Hancock sending a clear message.
You know, we have got to improve the entire system.
Saying the status quo is no longer acceptable.
This is not okay. Nobody deserves to be in pain or to see a loved one die when we know we could have saved them.
He's responding to more than 12 months of reporting. Facts that can no longer be ignored.
I've driven by level 1 trauma centers to get them back to Denver Health.
Paramedics coming forward, sounding off about a secret culture.
They had a poor outcome.
Did you get in trouble for taking a critically injured patient to the closest hospital instead of Denver Health?
Yes, I did.
Once? Twice?
More than that.
What would they say?
Why didn't you take them to Denver Health? You know all level 1 trauma goes to Denver Health.
Accusations about top managers pressuring paramedics to bypass qualified hospitals. Decisions questioned in emails by UC Health and confirmed by body cameras in East Denver.
Where are they taking him?
Right next door to University. Denver Health.
And more body camera questions uncovered in Sheridan.
She's most likely going to be transported to Swedish.
2 humans made bad decisions that day and took a child from this world.
Last October, one mother calling for answers and action.
My daughter deserved better.
Then in February, insiders pointed us to these emails. Firefighters exposing several examples of dangerous delays.
The emails are saying what we all know, is that there has been a long-time problem with how long it takes an ambulance to arrive on scene.
Then in June, we uncovered a database showing firefighters waiting 10, 20, sometimes more than 40 minutes for ambulances to arrive to critical emergency calls.
The people of Denver are not getting the service that they think they are getting.
We also found radio communications showing at times no available ambulances. 3 critical emergencies, and firefighters told there's no help on the way.
Engine 8, same traffic. They have no buses available at this time. Stand by. Engine 1, Engine 26, and Engine 8. We'll let you know.
How important is this?
Extremely.
You want it changed now?
I want it changed as soon as possible.
How would you describe what our reporting has uncovered?
Well, first of all, it's disappointing. It's painful to watch. I feel for the families. I feel for our firefighters who I know want to do the very best.
In this exclusive interview, Denver's mayor candidly addressed the issues and outlined a plan for change.
There's no excuse for the kind of delays that our firefighters articulated and you certainly showed on camera. So I cringed because I know we've been working on this issue for at least 14, 15 years now, and we've regressed.
When the leadership of Denver Health watches this story, what's the most important message you want them to get?
I've not been shy about concerns about response times and about what we believe we need to do.
At this time, Mayor Hancock's team is in contract negotiations with the leadership of Denver Health. The mayor promising a new contract will bring major changes to how the city manages emergency calls, including allowing Denver firefighters to provide more life-saving assistance.
Our firefighters have a desire to play a greater role to help save people, and we got to enable that. We want to share in the responsibility of helping to save lives. That's a big deal.
Will what happened in the past not be accepted in the future?
Listen, none of this is acceptable today. If you're talking about delayed response or not choosing the right emergency room to get people to for the best care, the quickest care, none of that's acceptable today. And so what we're going to do our very best to make sure that we limit those types of tough decisions and wrong decisions in the future.
Ranking sources also telling us the changes could include Denver Fire hiring its own medical director, opening the door for firefighters to provide advanced life support on calls. Now, Mayor Hancock told us he would like to have all of this resolved by the end of this year. So what is Denver Health's reaction to the mayor's call for change? With all due respect, you've dodged a lot of questions.
I've given you the answers that I think are appropriate and accurate.
Tomorrow night at 10, you will hear how the hospital's CEO answers our questions. I'm Chief Investigative Reporter Tony Kovaleski.
And Tony and the entire Denver7 investigative team have worked hard to bring you this story, and you can find their complete reporting on Denver Health right now at thedenverchannel.com.